Hey guys, so it is August 19th. Yeah, it's a Tuesday. Oh, today's my shot day. I almost forgot to do my shot. I want to do a video. I've been tossing around, talking a little bit about bottom surgery and where I'm at in the process of that. And so I want to go more into that. One of my buddies, local buddies, is up in San Francisco and has had the phalloplasty done, and he's been giving me reports on what his body's doing, what his emotional status is, how he looks at himself now, how he feels. And so let's just go through a little bit of his experience. He had his surgery with Dr. Crane in San Rafael, I think is where he's located, near San Francisco. And it was, I think he had surgery like on the 9th, something like that. I know the day, it was a Wednesday. I'm sorry, buddy, if I mess this up. But anyway, so his surgery took about 8.5 hours, and what Dr. Crane did is, I've mentioned about he does all the stages, he does everything in one stage except for the implants, and I'm correct. He does do everything, but what that everything entails is he does the skin graft for the phallus, he does a skin graft to the donor site, he attaches all the nerves and the blood vessels together, he extends the urethra, he embeds the clitoris if that's the route you're going, he does the vagectomy if that's what you're going for also. I believe he even, I'm not sure about anything else as far as other surgeries. The only thing that doesn't happen in this surgery is the implants, the testicle implants and your erection pump if you want one. I've been argued with about saying there's no possible way. Well, that's what he does. He does not have a few step surgeries to come to this surgery as one. He does this surgery as one. That's why it takes anywhere from 8 to 12 hours, providing nothing goes wrong. So our other choice is Dr. Meltzer in Arizona. He's well known. He does the phalloplasty in a couple different surgeries, a couple different stages. I didn't even look into his work. I didn't even look into his protocol on what happens from one surgery stage to another, because I always knew that I would go to Dr. Crane. I just believe in Dr. Crane. I like what he brings to the table for the transgender people. I respect his background and where he has done his intense training at, and he's a very, very nice guy. He cares about the individual. It's not just a money marketing thing. Honestly, if it was all about the money, I don't even know if he would contract with the insurance companies like he has. He's from the very beginning, he merged in with Dr. Brownstein. He has certain insurance companies he has always accepted. So that being said, he's a well-rounded individual. Any of you guys close to California might check into him and his website. And he said, now he did tell my buddy that the photos on the internet don't really do the surgeon justice to what it really ends up being in the long run. He does have more photos that he hasn't posted. They're like 2 and 3 years after the fact, and I'm not sure why he doesn't post them. I don't know that yet. I have not met with him personally yet, but that is, I see my second therapist on the 4th of September, and then after that, after the therapist feels that I am ready, excuse me a minute, girls, then he will give the okay to go to the next step, which is a consultation with Dr. Crane. So I'm not in a hurry. There's things I want to do with my body as best as I can in the state that I'm in, and try to decide which is best for me and my body. My main goal is to rid the female genitalia, everything. So if it means that a matoid, that I'm a candidate for a matoid with urethra lengthening, that'll be something I really consider, considering how intense the phalloplasty surgery is, considering my healing history with incisions, and just overall what it is that I in the long term want to see, how I want to view myself and how I will feel most comfortable. I know that once you do the matoid, that you can always go back and do the phalloplasty. I understand that, but who wants to go through another surgery, especially an intense surgery, as both of them are, 2 of them. So anyway, he looks great. There's no swelling at this time. He did run a fever, but there was no infection. The doctor did put him on antibiotics just in case. He said he was very swollen, and he said that the scrotum really does hurt when you hit it a certain way. So he's found that out already. He said the fever the doctor felt was a stress fever, and it only hit at night. So that's where he is right now. He is being discharged from the hospital today. He had to stay a week in the hospital. They opted to stay 1 extra night because of the fever, just in case. And they're going to an apartment they rented for the next 2 weeks, I think it is, or 3 weeks. 2 weeks. 3 weeks. Dr. Crane wants his patients to stay an extra 3 weeks after they're discharged, so that in case something happens, he's right there and they can address it right then and there. So that being said, that's where he's at on his journey. I keep him in our prayers and thoughts. Any guy, any female going through any kind of surgery on this transitional journey of ours, I do a blanket or an umbrella prayer for everybody, just to keep the positive energy going and in the midst of them, and comfort them through whatever they're going through. So anyway, that's what's going on with lower surgery again. I just wanted to kind of talk about his... Okay, my batteries died on me. So I just wanted to kind of go over his experience. He doesn't do YouTube videos, but just to add to, the mix about lower surgery, guys who are interested, guys who are curious. So far, his experience, and he said last night before saying goodnight that they did unwrap his arm. That's where the donor site was. It is very gross to look at, he said, however, and it is painful. He said, but all the pain is well worth it. So that kind of just, you can't expect not to hurt and be in pain with something so intense, especially as the phalloplasty. But either surgery, any surgery, in fact, when they're cutting on you, there's going to be some kind of pain going on depending on the intensity. He did mention that his emotional status is just so... It's in a state, he didn't have a word for it, but from what I got from how he was trying to describe it was just, he feels complete. He's happy. And you know, these days, through every day he goes through, it's just going to get closer and closer to the time where he's healing and be able to walk upright with no pain, no urethra issues. Hopefully he won't have any, but you know, just in case, when he gets ready to pee for the first time, that everything goes good, that his body has healed and formed the way it should. So anytime, I mean, this is such an intense surgery, and they've come a long way since the very beginning. I was looking at the outcome of the phalloplasty from guys from other countries in the early 2000s, mid 90s, and oh my gosh, you know, it's a matter of how you handle things as an individual, to where would you take the risk of just having something there called a penis, regardless if it looks like a penis or not. If this is all that was available to guys at that time, I gotta hand it to them, man. They've really overcame some emotional issues with that, because they did not look at all, you know, like a functioning penis. But man has come a long ways, and the knowledge and the technique is continuing to get better and better. I mean, I'm looking at possibly lower surgery a year and a half from now. So even in that year and a half, from complications or setbacks or just techniques that a doctor feels he can improve, I'm going to be a recipient of even better. And then after me, guys, after me, you'll probably be a recipient of even better. Who's to say what can happen in the future with our technology, with our knowledge, with how we grow, experiment, you know. Scientists are constantly, without us even knowing, are probably experimenting on things that's going to happen 20 years from now. My dad was a truck driver, and what he did is he delivered mud to oil rigs, which was it was an ingredient for them to process and get the oil out of the ground and process it and stuff. And he was on a short run and took me out about 20 miles from here, and he said, right here, and it was in the middle of nowhere, a desert. He said, right here underground, they have oil barrels labeled 2020. Now we're pretty close to 2020, but back then it was in the 70s. Could you imagine 50 years ago? I mean, whew. But so scientists and things that are going on, engineering and all this stuff, we have no clue really what our greater people are doing with the future. But so anyway, to get off that subject, so I wanted to kind of just give you an update on what's going on a freshly phalloplasty surgery that's happened that I have knowledge about, and share some of that healing and aftermath with you for those that are curious. Again, I'm just going through the process right now. I know something is going to change. It needs to change for me. And again, that has shifted in my journey. I, in the beginning, didn't think that I would ever look at lower surgery because of the techniques and because of the outcomes. And honestly, number one, the reason why I say all that stuff is because I knew I couldn't afford it. So you try to, you know, convince yourself, okay, well, you can't afford it, so you can't have it. Well, anyway, it's good you can't have it because of this and this and that and that. That's how I handle things. I find the weakest or the imperfective part of a situation, and if I can't go that route, then I start telling myself, okay, well, this is why. So that's how I handle things. But I hope you guys are doing well. I'm doing okay. I'm going into surgery Thursday for my foot, and although it's a really minor surgery, I'm still going to be put under general anesthetic because of where my blood vessels are and the main nerve in my foot is. So you just never know. This could be the last time I'm videoing, but you know, our destiny is our destiny, and there's nothing that we can do to change that. Whether it's at the hand of somebody else, or whether it's just by nature, or whatever. The destiny is the destiny. So anyway, you guys taking it one day at a time. Always please make your journey as simple as possible. Take care.